Welcome back. Thanks for staying with us tonight on In Focus. The health workforce of the future and its regulation will be the theme of the 24th Association of Medical Councils of Africa convention. The event will be held in the Northwest at the beginning of October. The aim of the conference is to facilitate the exchange of information and encourage dialogue to support best practice, innovation and knowledge sharing among health care practitioners and regulatory authorities in South Africa. Joining us now to tell us more about the event is Professor Simon Namadandani, President of the Health Professions Council of South Africa. Prof, good evening and thank you very much for your time. As the Health Professions Council of South Africa, why do you believe it's important at this time to have a conversation around the healthcare professionals of the future? We've just come out of a massive crisis called COVID-19, the pandemic. It's still with us. It's still not properly resolved. There's been some interventions technologically, mRNA vaccines that were introduced and so on and so forth. Why do you feel this is the right time, an important time, for us to have a conversation around what healthcare is going to look like in the future?
Good evening, and good evening to your viewers at home and all over in Africa. I think, as you have said, we have come out of a very difficult time with regard to COVID. It has affected almost every continent. Africa was not spared. Now, having said that, this is the opportunity where we can share the best practice across the continent, looking at what will be best in terms of training the proper healthcare practitioners that will be able to practice across Africa wherever there will be an outbreak or whatever condition that comes in Africa. So as HPCSA, we have partnered with AMCOA, which is the mother body that we are now hosting this conference to make sure that we've got the health practitioners across Africa that will be coming to our shores. But the purpose of this conference is specifically to look at the health workforce for the future, because this is where we are going. There is no border with regard to disease. You would know that this one started in China. Within a very short time of space, it has spread all over Africa and all over the continent. So no country will be spared unless we work together and make sure that we have competent health practitioners that can come to practice.
Yeah. Is there any particular thinking and rationale as to why the conference would be held in South Africa? I'll tell you why I ask. For example, recently the AIDS conference was held, and the criticism was that why hold the health conference in countries where there is not much of a burden of disease, and making it inaccessible for African countries who in most instances can't even afford their airplane ticket or their accommodation and so on and so forth. So they are not able to go there and share some of the knowledge and the best practices. So what is the thinking around bringing it to South Africa?
Maybe one should give a background about AMCOA and the relationship with HPCSA. HPCSA has been the founding member of AMCOA, which is the Association of Medical Council of Africa. So now this conference has been going around in Africa. You will remember that it has been hosted in other parts of Africa. In fact, we've got the SADC region, the ECOWAS, the West and the East. So this is our opportunity of this conference, to make sure that we are sharing the best practice that is happening here in South Africa. There is a lot that our counterparts in Africa are willing to learn. There will be a lot of people that are attending. We're expecting almost 800 colleagues from all over Africa, those who will be joining. There will also be those that are online. So basically, we would have an experience that we want to share and also learn from colleagues in Africa. It is a rotating conference. South Africa has an opportunity to host it and showcase what have we been doing, especially with regard to the training of the health workforce for the future. There is a lot that we can share with the world to make sure that they learn the best practice and also learn from our counterparts in Africa.
Yeah.
We are also making sure that we have the best in terms of the program. I think at the right time we'll share with the media the program that we have to make sure that ministers in Africa will be part of this conference, and also dignitaries that we would not be able to mention now. We are still securing the invitation so that they do grace this occasion.
What are the current assessment standards, right, when we're talking of healthcare professionalism in South Africa and in the continent?
Well, we are doing our best, and I think we should be able to say South Africa is ranking among the top countries in the world with regard to professionalism. We are training the best. You will remember that there is an exodus. I mean, immediately after we attained our independence, there were those who really moved out of South Africa to Canada and other African countries, and they are continuing to shine wherever they are. So South Africa is training the best. But however, there are challenges, as we are all aware, with regard to retention of those health professionals. But it is work in progress, which I believe the Department of Health and all stakeholders are pulling together to make sure that we do that. The other thing that I need to mention, as you would be aware, there are a lot of Africans, statesmen and women who do come to South Africa to get the best services that we have. This is an indication that South Africa has a lot to offer to the world. And we want to make sure that we continue on that platform to make sure that everyone benefits and also share our experience with our counterparts so that we can also take what we have in Africa, South Africa to Africa and make sure that they also bring what they have. We can work as a team.
Yeah. Amongst the issues that are highlighted, Prof, and I'm sure you've heard this mentioned numerous times, is that there is a great lack when it comes to primary health care in South Africa, and hence you would see a lot of the medical students being sent to Cuba, for example, a country which is believed to be leading, at least when it comes to primary health care. Are there lessons and are there benefits, do you think, that we can learn as a country from other African countries when it comes to this question of how to handle primary health care?
Yeah, I think there is a lot to learn from Africa, especially if you look at how we are putting our healthcare in Africa. Let's put, for an example, a simple thing that most of our training institutions for now, they are usually training to cure the disease, not much of prevention, which is why we have a lot of expenses and a lot of unfortunate death that could have been prevented if we had prepared our healthcare workers to make sure that they focus on the primary aspect of the disease rather than focusing on curative. And it's very expensive when you are focusing on the curative rather than on the primary. Now, most of the African countries, I'll give just as an example, if you take the situation where people don't have the resources that we have in South Africa, they focus more on the primary healthcare. But because South Africa is a divided society and we've got those that are extremely rich, and I will give just a good example. In one of the institutions where I was working, it was easy to get a rich person coming to the hospital using a helicopter because he was bitten by a scorpion. And whereas a person that has just been involved in a car accident in an N1 and it's in a critical situation, they're not able to get that facility to transport them. They have to wait along the N1 or whatever the road, and it's a matter of who has the resources. So these are the issues that we'll be addressing in this conference.
How important is the participation of policymakers? And I tell you the reason why this is a question is because, for example, we are dealing with the policy of NHI currently in South Africa. And some of the things that would inform what goes into that policy, I suppose, I'm imagining, are the deliberations and the inputs that would come from the healthcare practitioners who would be gathered at this conference.
Yeah, you see, policymakers are the enablers in whatever program that you want to implement, be it in health, be it in housing, be it in any environment. You have to make sure that you convince the policymakers, because these are the ones that will really make sure that there is funding. In this particular conference, the Ministry of Health, led by Dr. Joe Partha, and also other African ministers, we will have a round table discussion where the ministers of Africa will be participating. We have the ministers from Zimbabwe and other African, Ghana, those who will be attending. We will have these policymakers because it's critical that we make sure that they influence the direction in which these colleagues that will be gathering in Sun City would have decided. So at the end of the conference, there will be a policy or a statement that we are issuing, and we hope that the policymakers will translate it to enable that we do reach the target that we want to reach for South Africa and Africa at large.
Prof, we appreciate your time and thank you for highlighting this, and we look forward to more details as you flesh out the program of what will be discussed at this unique conference. That is Professor Simon Nemutandani, President of the Health Professionals Council of South Africa.